Hello and welcome to our action session. My name is Ben Levinson. My pronouns are he and they. I am the Deputy Director of Justice is Global, a special project of People's Action. And I'm really so excited to host this session. And the name of the panel is going to be Until Everyone is Safe, an action session with the People's Vaccine Alliance. And so we'll start in just a minute, but I want to encourage everyone to just put your name, your pronouns, where you're calling in from is Judy, and I'm going to pronounce your name wrong. It's not Elisa. I got it right. Elisa is, so if you could put your name in the chat, and we'll get started in just a minute. And for those who are just joining us, the purpose of this session is to talk about the amazing organizing that has been happening as part of a broad effort across the world, but particularly from the People's Vaccine Alliance in the US, about ways we've moved campaign work to ensure vaccines for everyone so we can end the pandemic. So we'll be talking about strategies and tactics that we've used and how we can really learn from these tactics and keep building our movement. So I will pass first to Emily to introduce herself and share a bit about, I want to introduce, call to everyone and ask y'all to introduce yourselves and share a little bit about how you've been impacted by this crisis. And then we'll start talking about strategy. So we'll start with Emily, then go to Shad, and then to Robbie.
Sure. Hi, everyone. My name is Emily. I use she, her pronouns, and I am the U.S. organizer at HealthGap. Before COVID, I had been working on global access to HIV medication. And now since COVID, it's all of the fights about pharma and like getting access to medicines across the world are all interconnected. So I'm here for that reason. And personally, I started doing some of this work. My mom died when I was 18 from breast cancer, but she would have died when I was 4 if I had been living in a place where I did not have access to good health insurance. And as I got older, I started to realize that that was not an accident, right? That people in high-income countries are the people who have better access to medical care. And so just by accident of birth, I was able to get to know my mom and live until I was 18 with her. So that is, that's why I'm here today. Pass it on to the next person.
Hi, everyone. I'm Shad. I use he, him pronouns. I am a medical student at Rutgers, New Jersey Medical School in Newark, New Jersey. And I work with Justice is Global on the Letter to the Editor to End the Pandemic Everywhere campaign. And why I'm here is particularly because of both my background as a medical student as well as my family. As a medical student, I work a lot with the population here in Newark, specifically with those experiencing homelessness. And every day we're working to make sure that there are no outbreaks going on in shelters. Every morning we're worried that there's going to be an outbreak going on, particularly because of the Delta variant and the rise of these variants. And so I'm concerned about that, particularly because as a medical student, as a person within the healthcare sphere, a lot of us have had issues with mental health because of the trauma associated with caring for patients throughout the pandemic. And I don't want to live in a world where I have to worry about that now as a medical student, as well as in the future as a physician. On top of that, as my family was had grown up abroad as well. My father is from Pakistan. And I remember when I was helping him get his second dose back in May, that was also the time when Pakistan and India were having some of their worst pandemic, worst COVID cases. And I thought about how my father probably would have died if he had lived in Pakistan today. He grew up very poor. He was selling things on the streets. And so he probably would not have had access to a ventilator, had access to an ICU bed, had access to a hospital bed nonetheless. And so I don't think that people around the world should have problems like should have those issues, and especially that could have been my dad. And I think that's incredibly important to me. And so that's why I'm here.
Hey everybody, this is Robbie Silverman. I use he, him pronouns, calling from outside of Boston. I work at Oxfam America. We are a global anti-poverty organization that's active in more than 70 countries around the world. and our mission is to combat poverty and injustice and inequality. And I have been sort of looking at the U.S. pharmaceutical sector for a long time. Oxfam has a history of working on access to medicines issues. And for us, Big Pharma really epitomized so much that's wrong with the way that corporate power drives inequality here in the US and all around the world. And so before COVID, we had been talking a lot with US pharmaceutical companies about the unconscionably high drug prices that they charge for life-saving medicines. We had been talking to them about how they dodge tax all over the world, depriving the public of desperately needed revenue. And we had been focused on how they use their sort of sky-high profits to buy political influence, which allows them to essentially, preserve the power that they have in this sort of unholy nexus between economic might and political power, and how we're focused on breaking that nexus. And as soon as COVID hit, we basically pivoted and were sort of laser focused on vaccine equity and access here in the US and all around the world. And really tried to convene as many organizations as we could and as many activists as we could under the umbrella of a people's vaccine. Basically a vaccine that would be freely available to all, that would be available based on need and risk and not ability to pay or where you live. And that would be a global public good available to everybody. And just speaking very personally, Emily, your story really resonated with me because my mom actually passed away from ovarian cancer when I was 21. And so that really resonated. And she was actually a women's health advocate for her career. She worked for Planned Parenthood and then for Women, Infants, and Children, WIC, at the end of her life as a nutrition consultant. And for me, so much of what we're seeing right now are these manifestations of inequality and public health the world over. And we know that women are so often bearing the brunt of this, both in terms of how they're directly impacted in health, also economically, and in the fact that they provide the vast majority of care work all around the world, both paid and unpaid. And so for me, COVID has really exposed a lot of the inequalities that we see. And I really want to make sure that our public response addresses those inequalities rather than increases them. And so it's really great to be with you all here today.
Thanks so much, everyone. We are also joined by a fourth speaker, Chioma Uru. We're trying to get her on camera, and she went as soon as we get her, we'll ask her to introduce herself. Oh, I think we have it. And as Chioma is getting set up, the first question. Oh, well, maybe I'll just share just a bit of my story because I think that could be just another wrinkle, like what brings me here. And part of my stake in this is that I have many people in my family who are educators who were really scared about being in schools around the pandemic and the surges. My brother works in a school in New York City, and we were like very anxious and concerned as all of the first outbreaks were happening in New York City. And my cousin in Connecticut. And so feeling very impacted by like the personal ways that this affects my family and the ways that people in my life that I love are really, their lives were disrupted and were really scared for many months and still are in schools today. So I hope that we can figure out structural problems to address this crisis and do so in a way that addresses it not just now, but for the future. And so that's why I'm here. I bring an energy to address the pandemic everywhere. And so we're still waiting on Chioma, but while we get her up here, I'll start with the first question, which is like in your work and what you've done to address this crisis. Oh, there we are. Hi, Chioma. If you would introduce yourself and say your name, your pronouns, and what brings you here, and how you've been impacted by this crisis.
Great. So my name is Chioma Oru, she, her, mother, if you don't know what else to call me. And I'm in Washington, D.C., great city without a state. I'm with the COVID Families Network, which is part of the CPD, Center for Popular Democracy, our local affiliate. I'm a member of here, Spaces in Action. And I'm impacted by COVID personally and, of course, politically, like everyone else. My father died of COVID on May 9th, 2020. Unfortunately, he was a person with dementia, a person with pre-existing conditions, and unfortunately we lost him, and that obviously propelled me into wanting no other family or no other person to have to go through what we've gone through. And so can I say something about CPD now, or do you want to ask questions or go with family?
Sure, say something about CPD and then we'll kick off with some more questions.
Sure. So with the COVID Families Network, which is, again, part of CPD, it's a national, global, actually, attempting to impact vaccine access, primarily in the global south, by getting the pharmaceutical companies to release the patents that they shouldn't even own, to be able to access the most vulnerable people on the planet. And of course that extends to our local situation. And in the District of Columbia, we have significantly impacted people, people with disabilities, Black and Brown and marginalized and other oppressed populations that are not accessing vaccines for multiple reasons, including vaccine hesitancy, and hoping we have humane ways and culturally affirming ways to address that hurdle for people in order to be able to get everybody where we want us to all go, which is fully vaccinated.
Thanks, Chioma. And I just want to share for anyone, if you have questions, we'll get into the rest of our questions for the panel. But if you have questions or comments, please use the chat. We'll make space at the end. If you have ways you'd like to hear more about what we're talking about strategy or tactics, or any of the policies that can be often very technical, we want to make sure this is as accessible and engaging as possible. So please put those in the chat and we'll make space at the end for about 10 minutes of questions. So we'd love to hear from all of our panelists about what you've done in this pandemic moment to organize, and what has particularly been successful. What's worked, what has really energized people in your networks and your organizations, and potentially even move the needle on this fight. And maybe we'll go to Robbie first.
Sure. So basically, as soon as COVID hit, addressing the pandemic became Oxfam's highest global priority here in the US and around the world, which basically meant we wanted to use every available advocacy tool that we had to try to bring an end to the pandemic as quickly as possible. And for us, that meant the most widespread availability of the vaccines. And so we started very early trying to leverage as many different approaches as possible. And for us, that included directly engaging the pharmaceutical manufacturers themselves. We have a history of basically dialoguing with them and challenging them around issues of access and equity. And we immediately started talking with them about vaccine access. Second, we went right to public policymakers. And so here in the US, that meant our allies in Congress. And then it was President Trump, now President Biden, basically calling the White House to use its executive authority to do all it could to make sure that vaccines were as widely available as possible. And then it also meant basically rallying as much public support for a people's vaccine as possible. And that meant using traditional media, social media, coalitions, our allies. Because we're a global organization, we have a presence in a lot of different countries around the world. And so making sure we were also in touch with local activists on the ground in countries that were really impacted. And then the other lever of sort of power that we wanted to wield is we recognize that pharmaceutical companies are a very challenging target. For the most part, they're very happy to prioritize their own profits over public health. We knew that going back to the AIDS epidemic and even before. But we also know that they are vulnerable. And in particular, they care a lot about what their investors think. They may claim to care about consumers and the public, but when it comes to their corporate investors, we know they actually listen. And so we at Oxfam actually own shares in the companies that we're engaging. And so we own shares in all the major drug companies. And we use that to actually directly challenge companies' power, where we file shareholder resolutions that go right to the company's board and senior executives at their shareholder meeting. And so we use that as a rallying point to basically show up at their big shareholder meetings and talk directly to the CEO and the board, basically challenging them on issues of access and affordability. And that's been a really powerful tool for us. And I want to say that, we knew we faced pretty daunting odds at the start of the pandemic. But I've actually been really encouraged that it does feel like we're having an impact. And just to take a couple of examples, for a long time, our advocacy was focused specifically on the White House because the US president has so much power in terms of opening up access and doing the right thing, and also the US's role on sort of global health policy. Under President Trump, it was basically just sort of, we got no traction. It was banging our head against a wall. I think he was very happy in global spaces to basically say, I don't care about global public health. All I care about are protecting US pharmaceutical company profits and making sure that the United States as a rich country has enough vaccines, and just made no effort at all to open up that access to the rest of the world. And President Biden took a different tone, both on the campaign trail and once he was in office. And we essentially called him on that. As a candidate, he had promised to share US technology. And we basically said, all right, if you're serious about that, you actually need to support a proposal made by more than 100 countries around the world to actually open up IP, the intellectual property behind the vaccines, so that we can share the recipe, so that every manufacturer in the world can make the vaccines that we all need. And it took a huge amount of effort, and we ended up having more than 2 million people around the world take action, calling on President Biden to take steps toward a people's vaccine. And in May, he made this historic decision that he would actually support this proposal by more than 100 countries around the world, led by India and South Africa, to actually support the sharing of the intellectual property. And that was a huge victory. And there's no question it came directly from the pressure that he felt from this global community of activists. And actually, I'll say that just today, we also got more good news. Even the pharma companies themselves, who are making just gajillions of dollars, just today, Moderna put out a statement basically saying, we recognize the need to do more. And they're still definitely not doing enough. But the only reason they put out that statement is because they're feeling the pressure and feeling the heat. And so to me, that was a clear sign that pressure works, even against very hard to reach targets. And we just have to keep it up and keep up the activism. So yeah, I mean, this continues to be our highest global priority, and we really do need everybody to take action to make sure that everybody has access to the vaccine.
Thanks, Robbie. We'd love to hear from Emily about some of the work that HealthGap has done around direct action and grassroots engagement.
Yeah. So like I said before, I work at HealthGap, the Health Global Access Project. And since our inception, we've been focused on getting access to HIV treatment to everyone around the world. And for those of you who are familiar with AIDS activism and the history behind that, there's this really deep, really powerful history of grassroots activism that uses both inside strategies and outside strategies. So right when COVID hit, there was this understanding within our movement, like, we know what to do. We've been preparing for this moment throughout the AIDS crisis, and now it's not exactly the same, but there's so many similarities between that fight and today's fight. So really, one of the first things that we were doing is connecting strategies and tactics that worked from the AIDS movement to what we're seeing with COVID, because we can show that way that there is a path forward. When we first had HIV treatment or treatment for AIDS, it was $10,000 per person per year. And that was only for people in wealthy countries. And at the creation of PEPFAR, a global fund to get treatment to people all across the world, at first it was only set for 55,000 people around the world. And now we're seeing millions of people being treated for HIV through that program. And we're seeing just over half of all people with HIV are now on treatment, which is huge. And that's how we're going to end the pandemic, right? So we're really familiar with Big Pharma's playbook and all the ways around that. And so that is one of the things we've been doing, and also really instilling really grounding ourselves in the idea. One of the most important tenets, I think, as an organizer is meeting people where they're at. And that's how we build a movement and how we build relationships with people. And throughout COVID, everyone has been going through it, right? To different degrees, but no one is okay. And so really drilling down on those personal relationships that we can have with people, and trusting people to organize in their own people in the way that they know is best. Showing that by Adrienne Marie Brown has this great tenet as an organizer, is that small is all. So really focusing in on those small relationships and those small connections we're able to have with people to build a global movement, because movements are all about people and the connections that we have with each other. And really the last thing I think that has been so successful in building grassroots energy is to just encourage everyone that you just do something. You don't have to do it perfectly. You by any means do not have to be an expert, but by just engaging, by showing up, by taking small actions and big actions as you are able, that's really what we're going to need in order to win a people's vaccine for everybody.
Thanks, Emily. Shad, would love to hear what you've been working on and what success you've had.
Yeah. So, like I said before, I was working on organizing medical students as a part of the Letter to the Editor campaign. And medical students are a difficult group to organize, I would say. We have very little time to do things outside of our academic work, and there's a lot of pressure to continue to do work within academia, so doing research, doing sort of clinical projects. And so there's very little sort of room for students to think about advocacy opportunities. But I think over the past year, COVID and this sort of like national advocacy work that's been going on has sort of changed that mindset partially. Doctors are now marching in Black Lives Matter protests and organizing single payer rallies. And now we can build on that energy for medical students as well, because medical students sort of feel safe to work within that sphere. I sort of utilize the message of how global vaccine access affects our daily lives as a big reason, as a big way of like connecting this issue to medical students, working with them on sort of a personal level rather than a sort of macro level, connecting to each individual person to ensure that everybody sort of understands the goal of our project and sort of understands their role within this movement. And I found that was incredibly successful. I think we got a good amount of medical students that are really passionate about this issue and are really excited about working on writing letters to the editor in local papers. And I think what a big part of this was that these students sort of understood the power that they hold as well. There's a fair amount of power that we hold as healthcare professionals, and so I think building on that was really, really key. Knowing that students had both privileges with this, but also responsibilities to work on global vaccine access and sort of work on improving the health of our society. This also led to a great amount of enthusiasm around just this entire campaign with the medical students, because they knew they had skin in the game regardless of the amount of work that was needed. They knew how important of an issue this was, and so they needed to play a role in that. They were also really excited about the fact that they could work on something on such a macro level. A lot of the work that's often done in institutions is very micro level, very local service projects, and so this type of a project was very exciting for a lot of students because they were able to actually connect with people nationwide on this major campaign that was actually affecting something halfway across the world. And I think that really helped get people excited about this movement.
Thanks, Shad. And Chioma, I wonder if you could say a little bit more about COVID families. And I know you've done some healing justice work, but question is, what's been successful in your organizing and movement work to address this problem to date?
Yeah, no, I think Emily hit it on the head, right? Like where relationships are extremely central to what pulled me into this work. I mean, so with COVID families, we come in, we're led by our fearless lead organizer, Vinay. Shout out to Vinay, who really helped to create a safe space for those of us who are politicized in different ways already, kind of working on different campaigns and are directly impacted. So, in the spirit of, what CPD is about, which is network building, we've had the opportunity of having this frequent, consistent space to share our pain, to share our joys, to share our organizing platform. So, one of the most inspirational members of the COVID network is Kristen Ukiza, marked by COVID, whose dad. She's a champion for us all. She speaks for us. Her voice is ours, for those of us who have been so directly impacted. And that has really been inspirational. So CPD has led demonstrations, die-ins, bird dogging, and also lobby days. I know that marked by COVID recently, this past summer in July, did have lobby days in terms of asking for key things for COVID families, like a form of recognition that we are economically impacted. We are impacted continuously for those who have pre-existing conditions in terms of centering families and centering children. What happens to children who have parents that have died from COVID that are now displaced? So those are some of the key issues nationally. And then globally, with putting pressure and having active creative demonstrations in front of Pfizer, in front of Moderna, engaging our president, Congress, our leaders globally, in the World Health Organization, in the World Trade Organization, anywhere that we know that pressures can and must be put, has been done. And of course, having opportunities like this to be able to politically educate around what we stand for and what we're about, because it's a multi-issue, multi-dynamic, and very personal thing when we talk about what it means to be part of the COVID families. I mean, we wear, I lost the closest person to me, one of the very closest people to me in the world. So and Kristen and so many of us are in the same place, and there's just a power in having that that healing avenue to be able to talk. I would say I've also personally had the opportunity to then try and take some of this systemically to be able, so I trained with the National Nurses United and for Medicare for All. So really aligning with the structural problems that have created this human crisis. We know that COVID is, has, of course, biological and, public health implications, but the real failures of COVID are political ones. These are man-made ones, the failures of our systems of care, how people are dying from COVID, not necessarily because of the disease itself, but because of the disparities that already exist. Who gets access to care? Who gets access to vaccines? Who gets access to treatment? I mean, we're in a different place when it comes to treatment, because last year, it was war, it still is, but it was so exaggerated in terms of just how violent that was. And so centering the work and remembering, right? Remembering what has occurred, what is occurring, and the economic impact that it has on communities on many different levels. So we continue to do that work in so many ways because our network is so vast in how we plug into the work. But we keep organizing science at the center.
Thank you for bringing that, Chioma, and just like appreciate and passion that you're sharing with our audience. And I would love to hear. I'll open this question up to the whole panel. We've heard about some different tactics and strategies folks have used. Robbie talked about investor resolutions, shareholder resolutions, and letters to the editor and direct actions. Curious if anyone could be a little bit more specific. Are there things that were like particularly energizing and exciting? I'm thinking, Emily, of actions in New York City or particular resolutions and reports that have come out around pharmaceutical companies. So we'd love to hear a little bit more specifically about which tactics were successful and also which tactics you might want to build on and keep working on as we keep moving in this campaign.
One thing I will share is not a tactic, but a strategy or a question as we're building our strategy is that to be effective as organizers, always at the center of deciding a tactic, deciding how we move forward is asking who is the target and how close can we get to them? How many barriers can we remove between us and our target so that our demand gets as close to them as possible? Chioma talked about bird dogging earlier. That's a great tactic. That's a great tactic in response to this question, right? Saying, finding for example, Joe Biden is one of our major targets in achieving global vaccine access. And so with bird dogging, right, finding out like where is Joe Biden going to be and how do we get people there so that we have the highest chance of him hearing us and seeing our message that we're carrying forward. Just getting as close to the person with decision-making power as possible. And I think really centering that in how we build out our strategy and the tactics we use is really important.
I want to cut in there and just share, Emily helped organize a really effective action in Philadelphia where the president was speaking and like folks made eye contact with him and his entourage with a sign that said, President Biden, free the vaccine, do what you promised. And I think it was the next week was the TRIPS waiver. So there were moments of getting directly in front of the target and just like a very good example of that in Philadelphia. The president was making a speech about Amtrak, but we were like, no, the important thing is about vaccine justice and how we can really push for that across.
And just remembering that the people that we know, I think it was Chioma that said it earlier that it's not just like Pfizer that is responsible for denying millions of people around the world vaccine access by not sharing this technology, right? It's like Albert Bourla, the CEO of Pfizer. It is people who are making these decisions. It's not faceless corporations. It's individual people, and they have addresses, and they have we know how to access them, right? So keeping that in mind as you build strategies going forward.
If I could jump in, I'd love to just emphasize the point about choosing your target and trying to get to them as close as possible. That's something we're trying to do with the Letter to the Editor campaign as well. One of the main purposes of our campaign is to get letters to the editor in local papers as opposed to national papers. And that would be sort of counterintuitive because you would kind of want to have a large national audience aware of what you're trying to talk about. But the point of this campaign is not only to just get attention about the issue, but get attention from the right people. And that is congressmen, congresswomen in your local area, in your voting districts, the things that they care about. And so getting these letters to the editor in local papers was a cornerstone for us because we're trying to make sure that they read what we're saying, and they're going to be interested in that because we are part of their voting district. We are now speaking up about this. And so this is an issue that they should care about as well.
Yeah, 100% agree. The media engagement on the local level, extremely important. That also has happened in various capacities. I think on the social media level, we also had a really successful video campaign to really express what the world we want to see. So it was a few of us that are directly impacted that circulated during mostly the election season, hashtagging, Trump lies, people die, and things like that. And that was really, I think, effective and efficient. But for me, the most impactful things are just that, the core huddling, the coming together, the political education, the learning spaces that get really personal, really intimate, and that help politicize. Because again, there's so many levels and layers to this. Having those central spaces that we can continuously reconvene to unpack, to share our strategies, to join in where we can, where people around the country impacted directly from the familial level and the community level can feel supported. And of course, being in Washington, D.C., being the playground, there have been successful demonstrations, lining of empty chairs and very impactful messaging that it speaks to where we are right now. And then in terms of where Pfizer and Moderna are making sure that their office buildings are constantly flooded with protesters and people, so that they're aware that this is not something that they can get away with without political pressure and public attention, meeting with Congress members, ensuring that they're taking the right positions on this, having call-ins and bird dogging is mentioned again, and bird dogging for the pharmaceuticals, bird dogging for our political leadership, and so many layers. And I feel very fortunate that the load is really shared, and this work is so heavy. No one person can carry it all.
Thank you.
Just if
Go for it, Robbie.
So one of the things that I think we tried to do as part of our power analysis is to figure out exactly who the key decision makers were to actually get a people's vaccine. And as part of that power analysis, it was so clear that the US president, because so much of our taxpayer dollars as American citizens has gone in to fund the development of the vaccines, and the fact that the US government actually holds some patents on the vaccines itself, and because the major vaccine manufacturers were headquartered here in the US, that basically the US president alone could get us a lot of the way towards achieving a people's vaccine. And so we really decided to focus a lot of our advocacy specifically on President Biden. And to piggyback on what a few folks were saying, a lot of our thinking was, how can we get to him most directly? And for us, it was a two-pronged strategy where, one, it was to get as many people as possible, just ordinary citizens, to take action and to sign a petition specifically targeting President Biden, calling him to put in place a people's vaccine. And we ended up getting 2 million signatories, which was kind of an amazing number. And second, we sort of went high to basically figure out who were the most influential people who he would actually listen to, who might actually have his ear. And so we ended up organizing a sign-on letter that was from former and current heads of state, Nobel laureates, and like basically the sort of most prominent economists, public health experts, faith leaders, artists and entertainers, have them both sign, but then also use their own platforms to call for a people's vaccine. And we basically tried to coalesce and have both of those strategies, encouraging a sort of very sort of high level advocacy and making sure that he also heard from ordinary people essentially converged at the same time. And one of our strategies was actually, we knew how to get to Ron Klain, who is President Biden's chief of staff. And we basically made sure that he got the letter, and so that he knew exactly what we were asking for. And we basically tried to do that ahead of these big May meetings where we know a lot of these issues would be adjudicated. And as folks have said, so much of it is on, calling him out, making sure that he follows through on his commitments. And so that's where we are right now, where he basically made this big commitment in May. And since then, it's been keeping up the pressure to make sure that he follows through to actually continue to exercise US leadership so we do end up with a people's vaccine. But for us, it was about that power analysis and then just encouraging as much grassroots activism as we could, specifically focused on the key decision maker.
And I want to add one more thing on top of all this is, I think as we build out a strategy as a movement, we must be centering the demands of people in the global South. At this point, of course, everyone around the world is being affected by COVID, but really what we're looking at is rich countries are rolling out booster shots right now, but 98% of people in low-income countries remain unvaccinated. And that's not an accident. This is a policy decision that has created a medical apartheid in our world. And while we're all people are getting boosters, but we really need to be focusing on, as we lay out this strategy, what do people in the global South need? What does their activism in their countries look like, and how can we amplify that? How can we build a campaign in the US to amplify those campaigns that are already happening?
Thanks for that, everyone. It's just exciting to hear and look back on the work that's been happening over the course of the last year plus. And I think what I would love to hear is where do you think this is going? What sorts of tactics will you try in your campaigning moving forward? What's gonna be the way that we can keep up the pressure to put the administration to ensure the administration does the right thing here? So yeah, I'll open that up to anyone who wants to share.
Hmm. I think it's important that we continue base building. I think, especially going into the gubernatorial elections next year, it's really important that we activate on the levels that I think CPD, through COVID Families, is successfully doing. We're connecting people's very personal interests to the shared interest so that it's not narrow self-interest, right? That it's a broadened, enlightened, communal self-interest. And I think that that way of getting into people's households. I mean, I was organized into this work, right? While I organize on different levels, me being present here, me being able to transform a very personal pain, an incredible loss that is inexplicable in so many ways. The only a part of the healing is taking action, is ensuring that other people don't have this as their narrative. I wouldn't gift this story to anybody. So, in recognizing that, we get into the hearts and the minds of regular everyday people in the different ways, and those that are politicized, and what we do with the information. We're armed with information to ensure that our local communities are aware. And I think the next level is being more effective in connecting those dots, in connecting the local to the global, because that's true on so many issues. But on this particular issue, I mean, lives are at stake. And so the need to connect those dots is a crucial and critical and skillful attempt to not just stay there in the personal connections, but start there and move into political action, which I think that we're doing, pretty well, considering, all the barriers that we faced this past year. And so, the future, I think, is ultimately bright. The organizing can get sharper, and I think victory is possible. And people have to know it and know what the fight is about. And not enough people fully. We're all going through it emotionally, right? Increased mental health supports is extremely important for everybody, even on the global level. I wonder what that looks like. What quarantining has done to the global South. I know that am Nigerian American, so I have a lot of family still at home. So part of that local global connection is also connecting with people who are intimately connected locally and globally, who live at that intersection. And I know people that didn't have electricity during quarantining. They couldn't store food. They lost a lot of food during that period. How are they recovering? How are they doing on a bigger scale than just the family, where we can independently do things to solve one household? How can we do it in a greater scale? And so I think that's the greater question at hand, and that we do that through more intimate organizing and politicizing households, which is extremely important.
Yeah, just to pick up on that point, for me, that is the path forward. It is uplifting those voices about real people on the front lines who are suffering right now. And I think a big part, one barrier that we face, is that people feel like this is very technical. The science is complicated, the politics are complicated. And so I think one thing is keeping our messaging super simple and super clear. And for us, a big part of that has been share the recipe, like that as the fundamental message. Because what you have right now is you basically have rich countries who essentially bought up the world supply of vaccines, which is why, exactly as Emily said, you have 1% of Africa that's been vaccinated compared to now almost 60% of the US. It is vaccine apartheid. And part of, I think, what we need to do is actually listen to the voices from the global South. And, just last month, President Biden held this big White House summit where he convened all these world leaders, and they were all patting themselves on the back. The US is going to donate another 500 million doses, and this country is going to donate X number of doses. And when you actually, at that meeting, the president of South Africa stood up and he basically said, we can't donate our way out of this crisis. What we want as South Africans is the right to manufacture our own doses for our own population. Give us the recipe. And that's what he said. And then the president of India stood up and said exactly the same thing. And so I think that's the direction that we need to head in, where the rest of the world isn't relying on the charity of rich countries the sort of table scraps that we donate, that we actually give them the power, give them the recipe so they can manufacture their own doses for their own citizens. And that's how we're going to get out of the crisis right now. But it also means we're going to be more resilient when the next crisis comes, to make sure that we actually are able to manufacture the number of vaccines that we actually need. The title of this panel is, until everybody is safe, no one is safe. And we're living that reality right now with Delta. The fact that even folks in the United States who are vaccinated are getting sick. And the longer the virus circulates in other places around the world, the more likely we're going to get another variant that's even worse. And so we need to redouble our activism, take those individual steps so our world leaders know that the status quo is not okay, vaccine apartheid is not okay, and that I don't feel safe until my brothers and sisters around the world are safe. And that's the message I think we need to hear, and we need to uplift those voices from regular people all over the world.
I'd like to add into that too, that we have been talking a little bit about the difference between strategies and tactics. And if we have a big picture strategy, right, that we're doing everything within our power to call out Joe Biden and his administration to demand a people's vaccine for around the world. But I want to say that I think the best tactics to use are the tactics that people in the movement are excited about. If you're excited about something and you're connected to people while you're doing it, that's movement building. And so really, like, we need people to come into this movement to add your ideas, to have creative ideas about how we can amplify this message, right? And organize going there forward. I think that a lot of times people think that organizers or people who lead organizations have all the ideas and they're the ones that are going to get us out of this, but it's really every single person who's involved with a movement that's contributing the tactics, they're the ones that make that happen. So just another shout that if you're not involved in this work yet and you feel at all motivated to be doing that, we need you. We need every idea for tactics moving forward as we can get.
Yeah, to piggyback off of all of that, I think all of that is exactly it. I really resonate with the idea that Chinoma was saying, that we really need to tap into the different spheres that are existing already. This is not just a vaccine issue. This is not just a science issue. This is not just a health issue. This is an immigration reform issue. This is a health reform issue. This is a mental health issue, domestic and global. And so we need to tap into the different groups that we have, the different networks that we have, and that's how we're going to be able to grow as a movement. Our voices are strongest when they're loudest, and I think we're going to be able to tap into as many groups as possible, and I think that's the way the way that this movement is going to move forward.
Yeah, and I'll just add a quick thing just to underscore why I think that this what everyone has just said feels so important, is that the problem here is not so much about not having the right policies or having good technology. It's about power. As Chioma said in the beginning, this is a political problem. And the way we solve political problems is by having more power than our opponents. And the way that people in progressive movements can have more power is by organizing more people. And so the goal for us, just like I'm just so moved by all that everyone is saying, is how do we move more people, and more people who've historically been disenfranchised and excluded from our political systems and our political movements. And so, yeah, just like loving the conversation that we're having here. And we've got a few more minutes left. So I'd love to hear Emily sort of kick this off with, like, we need more people involved in our work, more people to advocate and add their ideas and voices to the chorus. So can you share a little bit, open this to everyone, how can people get engaged in this movement, in your particular piece in the movement? And is there anything coming up that you want to plug that you think is like really dynamic and exciting?
I don't know if I would call this dynamic and exciting, but one like very urgent ask that we have of you all is we've had this petition that's open to the COVID czar in the White House, and he is one of the main people obstructing technology transfer from pharmaceutical companies to manufacturing hubs for the vaccine. And so we have a petition open right now. We have over 12,000 people signed on, but today is the last day to sign on to it. So if you could, that's just a really tangible, immediate action for people to take. I'll ask that someone share that in the chat so that everyone can see it. That's all I have for at this moment.
I mean, I'll just say there's some really key sort of global moments happening actually later this month. The G20, the sort of gathering of the heads of state of the most powerful countries around the world, is happening at the end of the month. And there are going to be a lot of opportunities to plug in for activism around those meetings. But in the meantime, like, President Biden needs to hear from us. Like, he needs to hear that we care about this, that, you know, he's taken some steps but needs to do more. And so, you know, I would light up the White House however you can. And then the other thing is, as big and powerful these pharma companies seem, they really care about their sort of public reputation, and they have very thin skins. And so, you know, anytime you have a chance to sort of go after them, tag them on social media, take action directly against them, like, they do not like that, because they like to think that they're out there saving the world. And when we sort of call them out and say, no, actually, you guys are fostering this inequality, you're not doing anywhere near enough, that's the message that they need to hear. And so I would say any chance you get to go right after the pharma companies, and to make sure that President Biden is hearing your concerns, that's great, especially because at the end of this month, there are these really big global moments happening where, you know, a lot of these decisions are going to start to get made.
I'll add in that, you know, COVID families were planning for an event called Build Back Better, which is to encourage President Biden in the relief bill to center, you know, healing justice, to center healthcare access to that, more around COVID domestically. So, you know, that's domestic, and I'm sure we'll keep putting pressure on the pharmaceutical industry to do better by the world, by the global south, particularly, as mentioned previously.
So we're not able to share the link for that petition that I mentioned in the chat, but if you go to bit.ly, that's bit.ly/people's vaccine now, all lowercase. That's bit.ly/people's vaccine now. You will be able to sign the petition that way. And again, today is the last day. So please, if you can do that now or right after this panel is over, it'd be very appreciated.
And then I'd love to talk really quickly about another sort of tangible thing you all could do, and that's join our Letter to the Editor campaign. We need people nationally to voice what has been going on throughout the pandemic. We all have stories that sort of resonate with everybody within our society, our local papers, our congressmen and women, and we need to voice those things. We need people from all spheres. We need people from all sectors, not just healthcare workers. I personally am working with medical students because I am a medical student, but we need everybody else as well to join in on this. And so we need people to join our Letter to the Editor campaign and just sort of talk about their stories. And so I think, Ben, you might be sending out that link afterwards. Okay. Yeah.
And I can share, just in addition and in collaboration with many folks on this call. But one of the ways to increase the grassroots people pressure is through direct action, and there are several direct actions that are coming up. Emily brought this up earlier: is how do we get as close to our targets as possible to really bring some of our pain and our suffering and the crisis that we feel to their doorsteps. So there will be a direct action just ahead of the G20 meeting in DC. There'll be an action in New York City with details to be determined. If you are interested in coming out and being in the streets and bringing your story and your voice to join our movement, we need you. We want to demonstrate the power that we have. We have more people. The vast majority of people support our issues. And what we need to do is make that visible and bring that to the people who make the decisions. So another of the steps that we'll share in the chat, and I'll share a bit.ly link, is to join a direct action in your community or organize one yourself. And we want to support everyone to take action in as creative and bold as a way as you can. So the link that you can use to get there is bit.ly, another bit.ly link that I'll share with you, but it's bit.ly/endpandemic netroots. So bit.ly/endpandemicnetroots. And if you sign that link, we'll have organizers reach out to you, figure out how you want to be engaged, how to support you, and keep you engaged in the movement that we're building that really is powered by everyday people who share common interest in this fight. So again, bit.ly/endpandemicnetroots. And I want to see if there are any questions. We have a couple more minutes. Any more questions from the audience? Now's a good chance. Put that in the chat. We'd love to direct those to our panelists. Questions about tactic or strategies. Thank you so much, whoever put that in the chat. You're amazing. And if not, then I want to see if our panelists have any closing words that you want to share to the audience as we go forth and figure out how to get a people's vaccine for everyone everywhere. So any closing thoughts or words?
Just may we never forget. May we never forget what has happened. We must discover restorative ways of dealing with the losses that have occurred around the world, in addition to, moving forward effectively to make sure that this doesn't happen again, not with COVID or any other biological problem that we may face in the future, that we strengthen our healthcare system. And that is really the work. That's the work, the global health system.
I guess I would just say it's so clear that COVID is this inequality virus. And it's also so clear that the struggle for vaccine equity is so deeply intertwined with so many other struggles that if you look within the United States at who was most impacted by COVID, it was people of color, indigenous communities, frontline healthcare workers, essential workers. Like that's who were by far disproportionately impacted. And too often those are the people that have the least access to vaccines. And it's the same thing happening right now across the globe, where you have rich countries that have all the doses and low-income countries have essentially none. And so the struggle for COVID equity is the same struggle, the global struggle for gender justice, racial justice, worker rights. And so I think we need to see this as a common struggle, and it's going to take all of us pulling together to actually produce a people's vaccine. And so I feel a lot of hope coming out of this panel and knowing all the actions that so many people around the world have taken, and we absolutely have to keep up the fight.
Yeah, I think the only thing I could say is really just remember the power that you have in your voices as well. Everybody has a story here. Everybody has stake in this. And so just remember the power that you have in this effort as well.
I think the last thing that I'll add is just keeping in mind, we've been talking a lot about the movement, but really, I hope that everyone is taking care of themselves and their neighbors and their community as best they can. There's so much unprocessed trauma that we're all facing. And that is not just going to go away, right? That's going to be part of this work going forward. And something that is definitely healing is collective action. So join the fight, go to the link in the chat and find a way to plug in. And also please take care of yourself and those around you.
Thank you all so much for sharing your story. And we hope many of you in the audience will join us. We'll see you in the streets and on the internet and in the boardrooms of corporations so we can really get a people's vaccine for everyone. So take care, have a good night and a good weekend.